Professor Rufai Ahmad, the Vice Chancellor, represented by the Deputy Vice Chancellor ACAD, Professor Ekaete Enang, the Provost, Professor Ngim, represented by Deputy Provost, Professor Sunday Bisong, yes. The Dean, Professor Nelson Osuchukwu, the HOD, Dr. Patrick, all deans, HODs, staff, and parents here this afternoon. Good afternoon to us all. This afternoon, I will be talking about movement, empowering movement, enhancing lives, the physiotherapy journey. As a way of starting, I just want us to move our hands. Please move your hands. Move your hands, everybody. Move your hands, move your hands, move your hands. Yes. Thank you very much. When we're in primary school, there's this thing, Mr. Niger. Do we remember Mr. Niger? And then they say characteristics of living thing. And the first thing was what? The first thing is what? Movement. Yes. Movement is the characteristics of living things. And movement is one of the things that makes you who you are. Movement, as a human being, movement not only improves, not only changes you, not only restores dignity, independence, and hope, it gives you better quality of life, gives you health, and gives you longevity. And so, as a physiotherapist, we should be happy and respect whom we are, because what we do is help people move. We help people move. That's in summary, that is what we do. Physiotherapy as a profession has evolved from post-war rehabilitation to a sophisticated, evidence-based healthcare profession. Today, we work across diverse settings, neurological rehabilitation, sports, cardio rehabilitation, pediatrics, geriatrics, chronic pain management, research, and the rest of them. Lancet, actually, 2011, has shown that early physiotherapy significantly improves stroke outcomes, while other studies have also shown that fall prevention is better achieved when people start physiotherapy, start movement, start exercising early. And for people who have been suffering problems with falls, this has actually reduced by 23% in many older adults when they start physiotherapy early. We are now recognized as first contact in many places, and this actually comes with a lot of responsibilities on us. We have to take carefully what we do. We are graduating today. We are happy. We are done with our studies. We are done with our anatomy, biochemistry, and the rest of exercise therapy, neuro, physiotherapy, cardio, and the rest of them. But that is not the end. It is just the beginning. Because, like I tell people, when I lecture students, I tell them, physiotherapy is a reading profession. If you want to be successful, you must read. If you want to be successful, you must sit down and reflect and have time to think about your patients in order to serve them better and to achieve more. For many of us, we look at physiotherapy and we see it as massage and the rest of it. I want to talk to our parents and some of our people that physiotherapy is beyond massage. The impact goes beyond this person is having pain, this person has some discomfort and all that. It affects every aspect of life. And for many who actually know what they are doing, you are not only impacting lives, you are actually changing people, and you remain in their memory for life. While I was in the HOD's office preparing trying to sit and wait for this place to be ready, I got a message from someone who just sent it. The mother turned 85 a few days ago, And the mother actually insisted that I must come for her birthday. That she doesn't care how far it is, but I must appear at her birthday. And that is the only thing that I will do for her to make her happy. So I took the challenge, and I was at her birthday. She showcased me to everybody. She held me. She said we must dance together and all that. And a retired teacher. And I felt very happy. I felt very satisfied. Why? Because to her, I have helped her to be able to stand and walk again. To her, I have helped her to be able to achieve that feat and be able to move around and be happy to see her children again. Now, that is one of the things. People to people, oh, this is what you do, this is what you do. But for some people, you remain a part of their story for life. Let me share a few stories with us because I want to talk about the impact of physiotherapy as you walk. If you walk with desire, if you walk with drive, you walk with devotion, you walk with discipline, you walk with determination and dedication, then for many, you will impact their life. You will be part of their story. You will come across all kinds of people. You will see children with all kinds of challenges, born with deformity and all that. In these children, sometimes you will notice neglect, even from their parents, even from caregivers. Do not keep quiet. Don't say, my own is just to do my work, do my physio and go. Call their attention to it. If you are talking to the caregiver and she's not listening, look for the parent of the child. Tell them. If the parent is not, talk to people. Let them know that this is not correct. This is abuse. Speak for people who cannot speak for themselves. Defend those who cannot defend themselves. You will meet with youth who are frustrated. You will meet with people who will feel life is not offering me anything. I remember a young girl, she says, sir, I am tired. I have come for physio, I have come for this, I have come for that. Every time it looks as if it is from one sickness to the other. I told her, don't worry, you don't know what life has for you. Life has something better for you. This is just a phase, it will pass. You will get well and you will look back. And you know what, that's about 10 years ago. That lady is the most successful person among her parents' children today. The last time she called me, she said, sir, I travel to Singapore, I travel to China, I travel to Dubai, I come back, I do all kinds of things. I'm building a house for my mom, and I'm wondering, look at me that wanted to kill myself, and look at what I'm achieving now. Look at, sir, I cannot thank you enough. Now, that is because at a point in life, I came in contact with her. You give them hope. You let them know that this movement thing, it will be solved. You will restore hope, quality of life. You will have better quality of life, and you will achieve your aim. Now, how about stories of people, elderly people? You meet with elderly people whom beyond their problems, because they have challenges, they cannot move, they cannot do this, they cannot do that, they suffer elder abuse. I hope we know that elders are one of the most vulnerable people. I hope we know. People will maltreat their elders, cheat them, collect their money, something that costs 1 naira, they say it's 10 naira and all that. And they think the elder is a fool because he's an elderly man. He's not talking, so they think he doesn't know. But he knows where they are. He's been there, so he knows what they are doing. But he's keeping quiet because if he says, you have done this, the person may not carry him to go and poo. The person may not assist him to clean him up. And so he keeps quiet and is watching. But when you assist these elderly people and you listen to them and you restore back hope to them, they begin to open up and begin to tell you things. I remember helping one old man, and the day I helped him to go to his toilet and he cleaned himself, I actually stayed there and watched him clean himself. And he cleaned himself successfully. When he stood up, he said, doctor, please hold on. Let me get back to my room. He got to his room. He said, please, doctor, I'm sorry, but please, I want you to kneel down. I want to pray for you. And I said, Papa, why not? I knelt down with joy. He prayed until he started crying. He said, you don't know what you have done for me, but I don't know how to express it again. He started crying again. He said, the shame of you want to poo, and every time you are looking for somebody to come and you are struggling, and you see people, your children are wherever they are, and now you are with all these caregivers, your wife cannot do it and all that. He said, you have just taken that shame away from me today, and I feel so happy. I don't know what I can do. The wife started dancing and all that. You see, these are things that money cannot buy, but these are things that impact people's life. And they remain for life. They remain for long. That elderly man, that happened many years ago. But just this year, the wife still called me and said, Papa said there's something for me. I have not come around. I should please come and collect it. I said, Ma, I am very, she said, no. Papa said, come and collect it. There's something that he has kept for you. Please come and carry it. And I said, okay, I will come and carry it. When I go back, I will go and carry it. Those are people you have touched and they feel happy. That's the profession you have been called into. A profession where you can help elderly people, you can assist them, you can make them happy again and restore hope all to them. And what am I saying? What I'm saying is, as you discharge your duties, remember that the people you are touching are people who have memories, are people who will remember, are people that coming in contact with them may turn into a lifetime relationship, are people that when you do something for, eventually you may be happy about it for the rest of your life. I have attended to a patient that he called me and said, please come to my house. I said, I was at the mechanic. My car is having issues. And then when I got to his house, he said, please come. I have discussed with my wife. Pick this car and go with it. That is what physiotherapy can do. I did not say I need a car, but I said, pick this car and go with it. That is what you can do for people. And I want to tell parents, thank you for sponsoring these ones to be physiotherapists, but I assure you that in the near future, you will be happy that you did what you did. Because they will not only bring money and all that, but people will see you and will be happy that these ones I'll be able to serve them. These ones were able to impact their life. Let me share another personal story. Some years ago, my mom was in Akwa Ibom for her birthday. And then my wife had organized a special birthday for her. And then to her greatest surprise, on her birthday, they called her from the government house and they said, we just want to greet you. We want to thank you. We want to thank you for giving us this man who has impacted lives, who has done this, who has done that, and all that, and all that. And then she was she said, who am I speaking to? And they told her who she's talking to and everything. She started calling her friends to tell them. Few moments later, gifts arrived. And they said, this is coming from the government house. They said, we should bring this for you. They said, this is coming from so-so commissioner. This is coming from so-so person. This is coming from so-so person. These are the people you are looking at in front of you. So parents, please be happy for yourselves. And the graduates, please clap for yourselves. I assure you, I believe that in the near future, the feats you will achieve, the places you will get to, the things you will do, the places you will get, and the kinds of things that people will say about you, you will hear them and you will rejoice. You might not know where you will get to. I started small. When I started, I worked with leprosy patients. I lived with them. I sat with them. I ate with them. I treated them. They came with their cries. They came with their stories. But from attending to leprosy patients, from leprosy patients, I started going to Ethiopia. I started coming back. I started going there. I started going there. And all that. And then I started moving to places I didn't go, I know I will get to. I started mixing with people I didn't know I will mix up with. And today, I look back and I say, oh, this is where things will get to. So don't look at where you are starting from. You may start small, but I assure you, in near future, the sky is your limit. Thank you very much. I want to say also that physiotherapy has diverse areas. There are diverse opportunities. You could go into clinical practice, work in hospitals, work in the unit, orthopedics, neuro, geriatrics, and the rest of them. You could work in community and public health, like I did when I started. You work in the community, you work with disabled people. You know, disabled people, they are wonderful people. They come with their challenges. Everybody has a complaint. Everybody wants to see you. You have treated 10 people yesterday. Tomorrow they are 12. The next day they are 15. And each day they come, they still want to see you one-on-one. They want to say something to you. Even if just good morning, they just want to hear something from you. And when they are coming, many a times you see them come. Somebody is coming with 2 mangoes. Somebody is coming with cassava. Somebody has picked something from the farm and is bringing to you. The other person has picked his chicken and is bringing to you. They don't want to tell you, oh, I don't have money, but this little thing I have, I want to give it to you and all that. You know, but the goodwill. I tell people, there's one thing about community service. People may not give you money, but their goodwill, their God bless you, it goes a long way. It does a lot in your life. You just see things working out for you. You could work in community. Then you could work in academy. You come and teach, come and lecture, do a lot of things, assist people in researches and the rest of them. We need a lot of lecturers. I hope we know. I hope we know. So I hope some of you are coming back. I'm not hearing anybody. I hope you are coming back. Please come back. And God will bless you. Yes, you could work in research, and you could work in special hospitals, advanced clinical roles, and the rest of them. You could work in international organizations. There are several international organizations where you can work comfortably, work in NGOs, and the rest of them. You can work in sports centers. There are a number of physiotherapists working with Super Eagles, working with certain clubs and the other and all that. But you have to be a sports physiotherapist and be ready to move around, because that is the challenge with being a sports physiotherapist. You might not even see your family in 3 weeks, not even in 2 months. Sometimes you are moving from place to place. So you are ready. If you want to go there, be ready. You could be an entrepreneur, dealing in one thing or the other, dealing with physiotherapy equipment, materials, and the rest of it. You could also do private practice. You open your setup, and then you are taking care of clients. You could do home visit. Home visit rehabilitation. You are seeing people in their homes, and as you attend to them in their homes, you are taking care of them, and they are paying for the services because you are cutting down on what they cost, what they spend in going to hospitals and the rest of them. Then you could do telehealth and digital rehabilitation. You talk to people on the phone, you talk to them, you do video calls, you guide them on exercises, certain exercises. They do those exercises, they report back to you how they feel, and when they report back to you, you tell them, okay, modify this, do this way, do this that way, and all that, and then they get back to you, and then you get your results. You could also work in the health administration and policy. We have few physiotherapists who are doing this, but those who are doing it are doing well. What am I saying? Opportunities are everywhere, and they are not specific to Nigeria. A lot of physiotherapists have Jakba, Abi? Yes. I'm not saying don't Jakba, but what I'm saying is that as you also Jakba, remember that you have parents around. Am I right? Yes. Don't Jakba. Everybody Jakbas and the parents are suffering. As we Jakba, let some people stay and work. Life is not about the money alone. Life is also about the thing we make out of it, the sacrifices we make, the lives we impact, the people we touch. My advice to graduates: build clinical experience through internships, voluntary work, join professional associations like the Nigerian Society of Physiotherapy, pursue continuing education and certifications relentlessly, work within the healthcare and rehabilitation community, consider research or academic projects to stand out, learn business and practice management skills. The world is genuinely open to you. Now, what is the journey ahead? To our graduates, you have options that few healthcare professionals enjoy. Whether you choose clinical practice, research, international work, or entrepreneurship, you must stay curious, find mentors, and also be a mentor yourself to these ones who are those who are coming behind you. You are entering the profession at a transformative moment. And to our students, to every expert was once where you are. The challenge you face now are preparing you for incredible opportunities. So keep going. And what do I say to our faculty? Your investment in education, research, funding, clinical placements, modern facilities and international partnerships, they have all paid off. And to fellow physiotherapists, mentorship isn't optional. We must support these coming after us, collaborate with them, generously teach them and assist them, and maintain the highest standards. And as we do so, our profession will keep on being greater. To parents, your children have chosen a profession of profound meaning and remarkable versatility. Be proud of them. In conclusion, let's understand that people around us who have passed through challenges, they are looking up to us to get solutions. We are going out to be solutions. And what do I say? Physiotherapy is the science that makes healing possible, and the human connection that makes trying worthwhile. Whether you are beginning your career, studying, teaching, or supporting someone in this field, you are part of this journey. And then I want to say congratulations to every one of us. Good afternoon.
Please keep clapping and don't stop.